Hello everyone, good evening. I hope I am audible to you guys. Can you just put a thumbs up just to tell me whether I'm audible to you and whether you can hear me properly or not? Great. So I can see a lot of you. So I'm good. How are you, Osama? I'm good. Good evening to all of you. Parth, good evening. Manisha, Lion, good evening. Yes, great. So I'm visible and audible to all of you. And I hope you guys are doing well and you are excited in this journey that we are already carrying out. We are going one by one chapter we are finishing, and we are creating a lot of concepts. We are creating a lot of thinking about a subject, right? It's not important to read a subject. The more important point is how we create a thinking, how we create a visualization about that subject. And that is what ENT surgery is all about. We are going to not only read ENT, we are going to reveal ENT in every class. We are going to reveal out the structures and we are going to create a concept about it. Great. Now, we have finished external ear as well as a middle ear compartment, right? And I took middle ear before just in order to make you sure that whatever structure I'm going to teach you today, you have some kind of an orientation about it. Now, when we read about middle ear, I told you there are various walls of the middle ear, right? When we were reading the middle ear. And in that various walls of the middle ear, what I told you was that my lateral wall of the middle ear is by a membrane, or there is a membrane which bridges my lateral wall of the middle ear. That is my lateral side. Now, if this is my lateral side, and if this is the side which is the one which is containing something which is connecting my middle ear to my external ear, right? So my external ear and my middle ear have something in between them, and that will form the lateral partition or my lateral compartment of my middle ear. And that is what we are going to read in this particular segment or this particular chapter. One of the most important segments as far as your ENT vivas are concerned. And that is why I have kept this as a different topic. So whenever you're going to write a case, whenever you're going to take a history, whenever you're going to present anything to the examiner in your professional exams, you will always find one question being asked to you from the examiner's side. And that he will tell you, draw me a normal tympanic membrane and show. And this is the point of time of truth. The examiner will realize whether you know ENT or not. So you have to be very sure, and we are going to draw the tympanic membrane together. I want you all to open your copies parallelly with me and start drawing. Whatever I'm telling you, you start drawing with me so that we can have a very good visualization of what is the right side and what is the left side tympanic membrane. Okay, fine. So let's dig into what this particular chapter is. What is the tympanic membrane or the lateral wall of the middle ear? Okay, fine. Now, what is this tympanic membrane all about? We are going to have certain discussions about certain things inside the tympanic membrane. Okay. So what are we going to read? We are going to first see what is the structure of tympanic membrane. We are going to make the structure of tympanic membrane. Okay. Then after the structure, we are going to go into and understand how to draw a tympanic membrane. And this drawing has to be what is the drawing on the right side as well as the left side. So we are going to draw both the tympanic membranes and we are going to see how to draw a normal tympanic membrane. Okay. Now, the third thing we will see is what are the layers of tympanic membrane. Okay. Next thing we will see is what is the blood supply of tympanic membrane. And the final thing will be the nerve supply of tympanic membrane. So we are going to go step by step and we are going to see and reveal all of these anatomical things of what is there inside a normal tympanic membrane. Okay, fine, chalo. Now let's go into one by one and first let's see what is the normal structure of the tympanic membrane, जो कि सबसे important चीज है इस particular topic में, ठीक है? Okay. Now, when we start the structure of tympanic membrane, we need to know that there are certain things which are important to know about the tympanic membrane. कुछ general चीजें देखते हैं. Okay. Now, what is the first thing that we need to know about the tympanic membrane? First thing is that it is an oval, semi-translucent membrane. It is an oval, semi-translucent membrane. Okay, so it's oval and it's semi-translucent. We can say it is around about grayish. Right, champion? I'm also happy to see you. Right? Thank you. So, Parth, is the mic not clear? Okay, right? Can you hear me? I think it's quite audible to everyone. Okay, so it's oval as well as semi-translucent. Okay, the second thing is that the tympanic membrane is present between our external ear and middle ear compartment. So it is present between our external ear and middle ear compartment. That is the second thing, right? So when we were looking into the external ear and middle ear, let me just draw a lateral diagram for you. That means you're seeing from the lateral side, right? Now, how does that look like? You had got an external auditory canal like this, right? And then when you drew the external auditory canal, then medial to the external auditory canal, you had this middle ear box. You had this box of middle ear. You had this box of middle ear, right? Now, in between this middle ear and external ear, there is a membrane which is bridging, and that is called as the tympanic membrane. Okay, there is a membrane present here, that is called as a tympanic membrane. Okay, so the tympanic membrane is present between our external ear and the middle ear compartment. Okay, this is what we should know. Now, the tympanic membrane is not straight. It is not straight. Rather, it is oblique. It is oblique. That means ऐसे नहीं खड़ा होगा. It won't be like this, right? Okay, I hope now the mic is fixed. I hope you guys can hear me properly now. Right? Okay, fine. So let me just continue. It is not straight. It is obliquely placed. Okay, it's kind of obliquely placed. That means the tympanic membrane is oblique. It is not placed like this. Rather, it is placed in this direction. Right? It's placed in this direction. Okay? So when I draw the tympanic membrane between the external as well as the middle ear, how will it be directed? It will be directed in this particular direction. In this particular direction. It is a little oblique. Okay, you can see that? It's a little oblique. And this obliquity or this oblique tympanic membrane creates an angle. You can see that? It creates an angle with the external auditory canal. Correct? And this angle, which is present between the external auditory canal and the tympanic membrane, this is called as what? This is called as tympanomeatal angle. Meatal, why? Because this is the meatus or the external auditory canal. Tympanum means the middle ear. So this angle, which is present between the tympanic membrane and the external auditory canal, because it is obliquely placed, this is going to be called as tympanomeatal angle. So ये angle का क्या नाम है? This is called as tympanomeatal angle. And this angle is around about 55 degrees. This is around 55 degrees to the horizontal. Okay, fine. So we have understood about how this particular tympanic membrane is placed in between our middle ear and external ear. Right? Okay. Now, let's go to the next thing. Let's understand that let's take out this tympanic membrane and let's see where exactly it is present. Right? I told you your external auditory canal is inside the tympanic part of temporal bone. Correct? It's inside the tympanic part of temporal bone, our external auditory canal. So hota kya hai? That this external auditory canal, when you see inside, or the terminal part of this external auditory canal, or the last part of this external auditory canal, it has got a sulcus. It has got a sulcus. Yani ki, what are you doing? You are looking inside the external auditory canal. And when you are looking inside the external auditory canal, the last part of the external auditory canal is this sulcus, and we call this as tympanic sulcus. We call this as tympanic sulcus. अब tympanic sulcus होता क्या है? Tympanic sulcus is the house of our tympanic membrane. यानी our tympanic membrane will be present inside this tympanic sulcus. It's a bony sulcus which is present in our external auditory canal, right? And it is present at the terminal end or the last part of our bony canal. And this bony canal contains a kind of a ring-like sulcus, and this is given the name as tympanic sulcus. Okay, fine. Now, if you see, I've made half. I've not completely made a circle. That means the tympanic sulcus is deficient superiorly. Okay, this is a very important thing that you should know, that my tympanic sulcus is deficient, यानी ये बना नहीं होता है superiorly. और जब ये नहीं बना होता है superiorly, so it forms a notch. And this notch, which is formed above, is like a triangle. And this notch is called as notch of Rivenus. This is called as notch of Rivenus. Okay? So there was some kind of, there was a scientist, okay, and his name was Augustus Rivenus. His name was Augustus Rivenus, right? And Augustus Rivenus के बाद ये notch आई, right? And that notch is called as notch of Rivenus, which is the deficient part of our superior canal. You can see superiorly, my tympanic sulcus is deficient. So it's forming a kind of a notch. And that is called as notch of Rivenus because of Augustus Rivenus, who was the first one to find it. अब इसी के अंदर हमारी पूरी tympanic membrane है. हमारी सारी tympanic membrane इसी के अंदर है. This is the house of our tympanic membrane that you should remember. Okay, fine. Now, what exactly is the tympanic membrane और ये होती कहाँ है और ये है क्या? I told you when I was telling you about middle ear that the tympanic membrane has got two parts, right? One is called as pars flaccida, which is above, and one is called as pars tensa, which is below. मतलब हमारी tympanic membrane के दो पार्ट हैं. एक पार्ट होता है pars tensa और एक पार्ट होता है छोटा सा, which is called as pars flaccida. यानी pars flaccida is present above, pars tensa is the one which is present below, right? And if you see, my pars tensa is inside the tympanic sulcus and my pars flaccida is within this notch of Rivenus. So this is also very important that you should know कि tympanic sulcus के अंदर जो part of tympanic membrane है वो pars tensa होगा और notch of Rivenus के अंदर जो भी होगा that will be for pars flaccida. Okay, are we understanding, right? So this is pars flaccida, which is within the notch of Rivenus. This is pars tensa, which is within the tympanic sulcus. This we have understood, right? Let me just make this a little darker for you so that you can see. See, this is your notch of Rivenus. Okay, fine. Now it's fine, right? चलो, अब हम लोग ने ये समझ लिया कि pars flaccida is where and pars tensa is where. Okay, so far so good. Now, just at the terminal portion of this tympanic sulcus, जहां पे ये tympanic sulcus खत्म हो रहा है, यहां पे एक important structure होता है. There is an important structure. Okay? Green is not visible. Okay? So let me just take out the green. Okay, let me just take out the green. Let me put a pink. Okay? Now can you see? Now is it visible? Okay? Now it's visible? Right? Please comment on if you can't see anything on the diagram. Okay? Because diagrams are the most important in this lecture. Right? Okay, great. Chalo. So now, अब सबसे important बात आती है कि what exactly are these projections? I told you there are two projections which are present on this tympanic sulcus. Right? एक projection होगा at the anterior side, एक projection होगा at the posterior side. तो tympanic sulcus में there are two projections. एक इधर, एक इधर. Let's say this is anterior side and this is posterior side. Now this projection which is present over on the tympanic sulcus, almost at the terminal end where my tympanic sulcus is finishing, right? Usama external auditory canal or auditory meatus same है. It is the same. When I was telling you external ear, it is the same. दोनों एक ही चीज होती हैं. Okay? So there are two things, right? Two projections which are present at the terminal end of the tympanic sulcus. ये anterior side के हम बोलते हैं anterior tympanic spine. We call this as anterior tympanic spine because ये spine की तरह projected है. It is projected in the form of a spine, right? And the other one which is present on the posterior side, इसको हम क्या बोलेंगे? We call this as posterior tympanic spine. Posterior tympanic spine. यानी कि मैंने अभी तक आपको क्या बताया? मैंने आपको बताया कि in the external auditory canal terminal part, यानी आपकी खत्म हो रही है external auditory canal, and there is a sulcus or a groove, और इस sulcus को हमने बोला tympanic sulcus. Correct? Tympanic sulcus is deficient superiorly, which is called as notch of Rivenus, जो कि एक साइंटिस्ट था ऑगस्टस रिवेनस, उसने ढूंढी थी, तो दैट इज व्हाई इट इज कॉल्ड एज नॉच ऑफ रिवेनस. At the terminal end of this tympanic sulcus, we have got two spines, one anteriorly, one posteriorly. Correct? Anterior one is called as anterior tympanic spine. Posterior one is called as posterior tympanic spine. Are we clear on this? Right? Are we clear on the concept of what exactly is this tympanic sulcus all about? Right? Kya ghar kya hai? What is the ghar of the pars tensa and the pars flaccida? Right? And I told you the tympanic membrane has got two parts. Pars tensa, tense matlab tensa, and pars flaccida, which is the upper portion, right? Pars flaccida notch of Rivenus के within होता है, pars tensa tympanic sulcus के within होता है. Okay, fine, right? Okay, now I'll tell you why it is flaccid. I'm going to tell you the reason. There are three reasons why it is flaccid, Soumyadeep. I'm going to tell you. Just hold on. Let me go into pars tensa and flaccida. चलो, now we have created the house. ये है क्या? What is this tympanic sulcus? अब हम लोग जाते हैं inside. What is this pars tensa and pars flaccida? Right? चलो. So now you know that you have got one ossicle. एक ossicle है जो present है, and let me draw that ossicle on the lateral section. And I discussed with you that what attaches on the pars tensa. There is a very important ossicle that is attaching to the pars tensa, and I told you इसे कहते हैं malleus. There is a malleus which is attaching to the pars tensa. So Tapa, the angle is tympanomeatal angle. Tympanomeatal angle. Okay? It's 55 degrees. Okay? Right. Now, अब हुआ क्या? What exactly we need to know here, right? So I told you कि एक malleus है, right? Malleus में एक head होता है, right? There is a head, there is a neck. ये head है, ये neck है. Right? Then there is a handle. इसे हम कहते हैं handle of malleus. And the handle of the malleus is the one which is attaching to the pars tensa. Right? So let's attach that. Let's attach that. और ये हो गई आपकी malleus जो attach हो रखी है. This is the malleus which is attaching in the pars tensa. तो आप देख रहे हैं, this is the handle of the malleus. जो दिख रहा है सामने से. This is the handle of the malleus. What you can see. दिख रहा है? Okay? So Tapa, it is tympanomeatal angle. What I told you. Tympano matlab tympanum, middle ear. Meatal matlab external auditory canal. Okay? Fine. So you have got this handle of malleus, और ये handle of malleus attach हो रहा है to the pars tensa. Correct? It is attaching to the pars of tensa. तो तभी ये handle of malleus दिख रहा है. क्योंकि अगर आप यहां से देखेंगे, if you see your tympanic membrane from here, you will see the handle of malleus. Correct? आपको यही दिखेगा. You will see the handle of the malleus. Right? Okay? Okay. Now, tympanic spine is a part of the tympanic sulcus. It's a part of the tympanic. बहुत छोटा सा spine होता है. It is a part of our tympanic sulcus. Okay, I hope it's clear. Okay, Anant Krishnan, I hope it's clear. Everything is a part of the temporal bone. See, everything what we are reading is inside the temporal bone. Right? Okay. Now, what you're seeing right now is कि आपने एक sulcus बनाया, आपने notch of Rivenus बनाई, आपने pars tensa रखी, आपने pars flaccida रखी, और pars tensa पे this is attached. And this is what? This is the handle of malleus. So this is your handle of malleus. This is your handle of malleus, which is attaching here. तो हमें एक ही ossicle दिख रही है. That is the handle of malleus. Why? Because we are seeing from outside. This is the view. Right? This is the view. Okay? Right? So I am showing you this image in all dimensions. जब आप सामने से देखेंगे, you will see this. जब आप साइड से देखेंगे, तो ये है. This is what exactly you should know. Right? Okay, fine. चलो. अब क्या करेंगे? What exactly this handle of malleus has? There is a fibrous fold. There is a fibrous fold. Fiber मतलब fiber का बना हुआ एक fold होता है. And that fibrous fold extends from the anterior tympanic spine and it attaches to the malleus. See here, ये पूरी malleus है, right? ये भी malleus है. तो ये fold attach हो रहा है from the anterior tympanic spine to the malleus. And एक और fold attach हो रहा है from the posterior tympanic spine to the malleus. Can you see that? Right? Can you see that? One fold is attaching from the anterior tympanic spine to the malleus. One fold is attaching from the posterior tympanic spine to the malleus. So that means there are two folds. One anterior, one posterior. And both are coming from their tympanic spines and they are attaching to the malleus. Correct? Is fold ko we will call it as anterior malleal fold. We will call this as anterior malleal fold. We will call this fold as anterior malleol fold, and we will call this as posterior malleol fold. यानी कि ये होते क्या हैं? These are nothing but these are just fibrous folds. ये फाइबर से बने होते हैं, right? And they are extending from tympanic spine and they are attaching to the malleus. एक एंटीरियरली अटैच हो रहा है, एक पोस्टीरियरली अटैच हो रहा है. एंटीरियर वाले को बोला एंटीरियर मैलियल फोल्ड, पोस्टीरियर वाले को बोला पोस्टीरियर मैलियल फोल्ड, इन सिंपल वर्ड्स. एंड बोथ आर अटैचिंग टू द मैलियस. दे आर मेड अप ऑफ फाइबर्स. ओके फाइन. अभी क्लियर ऑन दीज फोल्ड्स. तो व्हाट आई कैन सी राइट नाउ, अभी हम क्या बोल सकते हैं? व्हाट आई कैन विजुअलाइज इज कि व्हाट इज आवर पार्स फ्लैसिडा. व्हाट इज द पार्स फ्लैसिडा? एनीथिंग विच इज अबव माई anterior and posterior malleol folds is my pars flaccida, and anything which is below my anterior and posterior malleol fold is my pars tensa. So in simple words, what can I say? There can be two things. There is anterior malleol fold, there is posterior malleol fold, right? Anterior and posterior malleol fold के ऊपर कुछ भी होगा, we will call that as pars flaccida. And anterior and posterior malleol fold के कुछ भी नीचे होगा, we will call it as pars tensa. Pars flaccida is present within this notch of Rivinus. Pars tensa is present within this tympanic sulcus. I hope this is clear. Right? I hope you guys are understanding about what is going on. Okay? So this is a very, very important logic behind what is the pars tensa or what is the pars flaccida और ये किसके अंदर होते हैं. Then we are going to see कि ये pars tensa किससे बने होते हैं and pars flaccida किससे बना होता है. We are going to see later on. Right? So now I hope you guys have understood what is the location of pars tensa and pars flaccida. चलो. So far so good. Okay? Now, अब I'll take out one of this tympanic membrane. अब मैं इसको निकाल लेता हूँ. I've taken this tympanic membrane out of the tympanic sulcus. I've taken it out. ठीक है? Now when I take it out, let's say, when I take it out, I have this kind of a structure. Right? I've taken it out. ये टिम्पैनिक सल्कस से बाहर आ गया है. अब मुझे पता है इसमें मैलियस है, इसके दो फोल्ड हैं. एक फोल्ड है एंटीरियर मैलियल फोल्ड, एक फोल्ड है पोस्टीरियर मैलियल फोल्ड. करेक्ट? दिस इज द पार्स टेंसा, दिस इज द पार्स फ्लैसिडा. पार्स फ्लैसिडा इज प्रेजेंट विद इन द नॉच ऑफ रिविनस. पार्स टेंसा इज प्रेजेंट विद इन द टिम्पैनिक सल्कस. ओके, दिस इज व्हाट एग्जैक्टली वी हैव रेड. करेक्ट? राइट? ओके, नाउ what is the dimension of the tympanic membrane? और dimension मतलब कि कितनी बड़ी होती है. कितनी बड़ी होती है tympanic membrane? It's very very small. ENT surgery is a very small domain. तो सब मिलीमीटर में होता है. Everything is in millimeter inside the ear. Okay? So the tympanic membrane is 9 to 10 millimeters tall. 9 to 10 millimeters ये tall है. Okay? 8 to 9 millimeters wide. 8 to 9 millimeter broad है. Okay? And it is 0.1 millimeter thick. 0.1 millimeter thick. Okay? Right? So this is about the dimension of the tympanic membrane. It is about 9 to 10 millimeters long, 8 to 9 millimeters wide or broad, and 0.1 millimeters thick. Okay? So I hope you guys have understood about it. I hope you guys are understanding till now what is happening. Okay? Chalo. Right. Now, one more important thing. जब हम tympanic membrane को देखते हैं, और when we are seeing this tympanic membrane, right? इस tympanic membrane के दो surface हैं. एक surface जो हम देख रहे हैं और एक surface जो medial है. यानी कि एक surface which is present towards the middle ear, one surface which is towards you, or one surface which is towards your eye, right? So the actual tympanic membrane is not like this. It's actually like this. It's actually placed like this. And then you have got, one second. Okay. Okay. So your actual tympanic membrane is like this when you see it from the side. Okay. And this is the normal structure of the tympanic membrane. That means it is bent medially. Yani ki the medial surface of the tympanic membrane is somewhat convex. It is convex. And the lateral surface of the tympanic membrane is concave. Lateral surface is concave, medial surface is convex. And you can see that this is convex and lateral one, what you're seeing is concave. यानी कि अगर सामने से आप tympanic membrane देखेंगे, it will appear like this. Okay, it has a bump in the center. Okay, now why is this bump present? There is a reason, and I'm going to tell you later on. ठीक है, अब इसके बारे में हम पढ़ेंगे. So what you need to know, the lateral surface of the tympanic membrane is concave, and the medial surface of the tympanic membrane is convex. Okay, so when you're seeing it laterally, the lateral one is concave, the medial one is convex. Okay, fine. So abhi tak humne kya kiya? We have done the house of the tympanic membrane. We have done what is the tympanic sulcus. We have done what is the notch of Ravenous. We have done what is anterior and posterior tympanic spine. We have done what is pars tensa, what is pars flaccida, ये कहाँ पे होते हैं. We have done about anterior and posterior malleal fold, जो attach होते हैं malleus पे. And we have understood about the dimensions of tympanic membrane with the surfaces कि एक surface इसका lateral concave होता है and the medial surface is convex. This is what we have understood till now. Okay, till now we have done this much, right? Ab I am going to show you how to draw a normal tympanic membrane. और ये tympanic membrane होती क्या है, right? Or what exactly is the inside story of the tympanic membrane? Chalo, let us start now. Now, always remember one thing. If you are drawing a right side tympanic membrane, अपना हाथ right की तरफ tilt कर दो. Tilt your hand towards the right side. If you are drawing a tympanic membrane of the left side, tilt your hand towards the left side. Okay, अब इसका क्या मतलब हुआ? That means if I'm drawing the right side tympanic membrane, I'll tilt my hand, I'll draw a circle which is tilted towards the right. If I'm drawing a left side tympanic membrane, then I'll tilt my hand towards the left. ये मेरी हो गई दो tympanic membrane, एक इस तरफ, एक इस तरफ. Okay, fine. Now, I told you that there are two important things inside it, right? One is pars tensa, one is pars flaccida. तो अब आपको क्या करना है? You have to draw the malleus and you have to draw the malleal folds. You have to draw the malleus and the malleal folds. And you know what is this in the center. This is the handle of the malleus which is attaching to the pars tensa. I already told you, right? So this is what? This is your handle of malleus. This is your handle of malleus. What you can see. This is the handle of malleus. What you can see. Okay? Fine? Correct? Same way, draw here. This is the handle of malleus. This is the handle of malleus. I'll just write here HOM. Okay, just for the sake of convenience. Okay, fine. Now a very important point. The point where this handle of malleus attaches, the point where this handle of malleus is attaching, this is the point which will create the maximum concavity in the lateral surface. Okay, so let me just go back to what I taught you there, right? I told you that this handle of malleus is attaching on the medial side, right? So when this attaches here, this is going to kind of pull the tympanic membrane inwards. Okay? And this point of attachment of the tympanic membrane, this where the handle of malleus is attaching to the tympanic membrane, this point is called as umbo. This is called as umbo. Yani ki jahan pe handle of malleus attaches on the tympanic membrane, that portion will create a bump in the lateral wall. It will kind of create a concavity. Right? And this concavity or this bump is called as umbo. This is called as the umbo. So where is the umbo here? This point where my handle of malleus is attaching, is point ko we will call it umbo. The center point where my handle of malleus is attaching. Ise hum log bolenge umbo. Okay? Right. Now, you know this is the pars flaccida. This is the pars flaccida. Right? Okay? And this is your pars tensa. This is your pars tensa. Okay? Same way idhar. This is your pars tensa. This is your pars tensa. And this is your pars flaccida. And I hope you guys are drawing with me. Please draw with me. Because the thing is, this is the thing which you have to draw all throughout your ENT postings. Okay? So left wali left ki taraf hai, right wali right ki taraf hai, and you are oriented to both the sides. Okay? And this is the umbo, what we have recently discussed. Okay, now coming to first, what exactly is this pars tensa all about? Pars tensa को हम tensa क्यों बोलते हैं? इसको एक रीजन है. इसको हम tensa क्यों बोलते हैं? इसका एक रीजन है. आपने टेनिस का रैकेट देखा है? Have you seen a tennis racket? Right? When you play tennis, so whenever you are playing tennis, you hit the shuttle from the center, right? and the shuttle will go far. Correct? जब shuttlecock मारते हैं तो आप center से मारते हैं. The same way, when the sound is coming in the ear, the sound will strike right away in the center of the pars tensa. तो होता क्या है, when the sound is striking to the pars tensa, tympanic membrane अंदर move करेगी and then वो retract करेगी. फिर उसके बाद अंदर मूव करेगी, देन वो बाहर मूव करेगी, अंदर मूव करेगी, देन वो बाहर मूव करेगी. तो ये recoiling action of the tympanic membrane is happening every day whenever you're hearing sound. Okay? And this is the point where you will get the maximum concavity, or you will get the maximum concavity over this area in the center of the pars tensa. तभी whenever we hit the shuttlecock, we hit it from the center, not from the rim. इसी रीजन से साउंड भी सेंटर में हमेशा जाता है. It happens to go in the center of the tympanic membrane, okay, which is the most concave, right? Soumyadeep, it is on the tympanic sulcus. It is lateral. It is lateral, right? आप यहाँ पे देखो. If you are not visualizing, see this. See, this is your tympanic sulcus. ये आपका tympanic sulcus है. यहाँ पे हैं वो spines. यहाँ पे हैं वो spines. Right? Where these folds are coming from. Okay, are we understanding? Right? I hope, Soumyadeep, you have understood. Right? Okay, where these anterior and posterior malleal folds are present. Okay. So I told you, the sound hits in the right away in the center, where it is the maximum concavity, or this is a point which we call as the umbo. Right? Okay. Now let's do one thing. Okay? Let's study something about this pars tensa. हम इस pars tensa को निकालते हैं, and we study about this pars tensa. उसके बाद we will read something about this pars flaccida. Right? और उसके बाद हम structure बनाएंगे. अब what is this pars tensa, और इसे हम tensa क्यों कहते हैं? Right? That is the most important thing. So let me just go here and let me just show you something why it is called as tensa. The tympanic membrane is made up of 3 layers. यानी कि अगर हम साइड से देखें तो tympanic membrane में, अगर ये मेरी tympanic membrane है, if this is my tympanic membrane and I cut this tympanic membrane and I see it, then it will have 3 layers. एक बाहर, एक center में, and one inside. So there are 3 layers in my tympanic membrane. Okay? I'm going to come to the significance of pars tensa. Okay, just hold on. Just hold on. Everyone just hold on. I'm going to show you what the pars tensa is. Iske pehle I finish, you guys will be making the pars tensa and flaccida completely. I've not finished. Still a lot of things are left. So there are 3 layers in my pars, or in my tympanic membrane. There are 3 layers in my tympanic membrane. One, it is the outer layer. I call this layer as epithelial layer. Center layer is called as fibrous layer. And the innermost layer is called as mucosal layer. यानी कि tympanic membrane की 3 लेयर होती हैं. एक लेयर होती है external auditory canal की तरफ, which is called as epithelial layer. एक इनके बीच में होती है, which is called as fibrous layer. और एक होती है towards the middle ear compartment, and this is called as the mucosal layer. Okay? These are the 3 layers of my tympanic membrane. All the 3 layers are present in your tympanic membrane. Middle fibrous, inner mucosal, outer epithelial. Okay? This epithelial layer, which is present towards my external auditory canal, okay, towards my external auditory canal, this is lined by stratified squamous epithelium. This is lined by stratified squamous epithelium. This is lined by stratified squamous. Stratified squamous का मतलब क्या होता है? खूब सारे squamous cells हैं. एक दूसरे के ऊपर there are many squamous cells. That is why we call it as stratified, multiple layers. Right? Okay? Inner mucosal layer is the one which is continuous with our middle ear. That's continuous with our middle ear, right? This is lined by cube-like cells, or we can call it as cuboidal epithelium. This is lined by cuboidal epithelium or cube-like cells. Okay? And then comes this layer in the center, which is called as a fibrous layer. और fibrous का मतलब ही है ये fiber से बनी होगी. So this layer is fibrous layer. Why? Because it contains type 2 and 3 collagen fibers. Type 2 and 3 collagen fibers are present in this fibrous layer. Okay? Right? Now, the more you know about this, the things will get revealed to you. Okay? So just stick on. I'll tell you about pars tensa flaccida. Abhi bahut kahani baki hai. So I told you your tympanic membrane has got 3 layers: outer epithelial, middle fibrous, inner mucosal. म्यूकोजल लेयर में क्यूबॉइडल सेल्स होते हैं, आउटर एपिथेलियल में स्ट्रैटिफाइड स्क्वामस एपिथेलियम होता है, सेंटर में फाइब्रस लेयर में फाइबर्स होते हैं विच इज टाइप 2 एंड टाइप 3 कोलाजन फाइबर्स. ओके, नाउ अगर हम इस फाइब्रस लेयर को निकाल के देखें, right, if I take out this fibrous layer and see how the fibers are arranged in my tympanic membrane, what will I see? That in my tympanic membrane, this fibrous layer in the pars tensa has got 3 types of fibers or 3 types of configuration of fibers. यानी कि द फाइब्रस लेयर इज वेरी वेल फॉर्म्ड इन आवर पार्स टेंसा. ओके, एंड इट हैज गॉट 3 टाइप्स ऑफ कॉन्फ़िगरेशन. कॉन्फ़िगरेशन का मतलब 3 तरीके से फाइबर्स आर प्रेजेंट इन आवर पार्स टेंसा. ओके, नाउ व्हाट आर दीज कॉन्फ़िगरेशंस? द फाइबर्स इन द पार्स टेंसा इन द फाइब्रस लेयर कैन बी इन अ रेडियल डायरेक्शन. ये कौन सा डायरेक्शन होता है? दिस इज कॉल्ड एज रेडियल डायरेक्शन. रेडियल फाइबर्स और रेडियल डायरेक्शन जो अंदर से बाहर आते हैं स्ट्रेट, दे आर कॉल्ड एज रेडियल फाइबर्स. और दे कैन बी लाइक अ गोल सरकमफ्रेंस. तो इसे हम क्या बोलते हैं? दीज आर कॉल्ड एज सर्कमफेरेंशियल फाइबर्स. दीज आर कॉल्ड एज सर्कमफेरेंशियल फाइबर्स. दे आर इन द फॉर्म ऑफ अ सर्कमफ्रेंस, राइट? ये ऐसे ऐसे घूम रहे हैं, दे आर सर्कमफेरेंशियल. एंड द थर्ड इज कमिंग इन द फॉर्म ऑफ अ पैराबोला. जैसे पैराबोला लंबा लंबा आता है, राइट? दीज आर कॉल्ड एज parabolic fibers. So what did I tell you? That the fibrous layer of my pars tensa or the fibrous layer of the tympanic membrane contains 3 configuration of fibers. A configuration is coming out in a radial direction. One configuration is coming out in a circumferential direction, circle, and the other one is coming out longitudinally in the form of a parabola. जिसे हम बोलते हैं parabolic fibers, circumferential fiber, as well as radial fibers. 3 तरीके के fiber हैं within this pars tensa. That means pars tensa has got a very good and tight arrangement of fibrous layer. And that is why pars tensa is tense. Why? Because it has got a very well formed fibrous layer and it has got all the 3 configurations of fibers inside this pars tensa. तभी हम tensa को tense बोलते हैं. Are we understanding that? Right? Now, if you see the pars flaccida up here, this configuration of fibers, the parabolic, radial as well as circumferential, are deficient in the pars flaccida. That means pars flaccida does not have, or it has got an ill-formed fibrous layer. Ill-formed fibrous layer. यानी कि ये सारे के सारे डायरेक्शन ऑफ फाइबर्स नहीं होते. They are not very well formed, right, in the pars flaccida. That is why pars flaccida is flaccid. Why? Because it has got a deficient fibrous layer. Pars tensa is tense. Why? Because it has got a very well formed fibrous layer. Okay, are we understanding this logic? कि pars flaccida में नहीं होते, fibrous layer is not very well formed, as well as tensa में the fibrous layer is quite well formed. Okay, that is the first difference. Right? चलो, अभी we have understood this much. Still a lot to go. अब होता क्या है? That this fibrous layer of the pars tensa, this fibrous layer of the pars tensa, only about the tensa. This fibrous layer, it goes laterally. This fibrous layer goes laterally. The fibers go laterally. And what happens is, they kind of form a thickened rim. They kind of form a very thick rim. They form a very thick rim. हम देख रहे हैं orange color की, they are forming a thick rim. That means all of these fibers are going laterally towards the end of the pars tensa, and they are basically forming a thick rim. And this thick rim, which is present around the pars tensa, formed by the fibrous layer condensation, is called as annulus. This is called as annulus. This is called as annulus. Okay? Right? So what is this annulus? Annulus is the condensation of the fibrous layer on the lateral margin of the pars tensa. Okay? Yes, सौम्यदीप, malleus medial है, malleus is medial to the tympanic membrane. और वो ये जो हम देख रहे हैं ना, they are going ऐसे, they are going lateral to medial direction. They are going lateral to medial, ऐसे जोड़ रहे हैं. Okay, the tympanic membrane is over it. Are we understanding? Right? I hope you guys are understanding what is lateral, what is medial. Okay? Tympanic membrane एक दरवाजा है, इसके जब हम हटाएंगे, then we'll see these folds. They are stuck to each other actually. Okay? Fine. They are all medial to the tympanic membrane. Right? Okay. Now let's come to what exactly is this annulus again. Annulus is what? Annulus is the condensation of the fibrous layer of the tympanic membrane laterally, and it forms this kind of a thickened rim. And this is only around the pars tensa. ये pars flaccida के around नहीं होता. That means I told you two important points why pars flaccida is flaccid. One is, ये annulus सिर्फ tensa के around है, it is not around the pars flaccida. That is first reason why the pars flaccida is flaccid. Second reason is that this pars tensa has got three configuration of fibers, that is circumferential, parabolic and radial, which are deficient in our pars flaccida. Two reasons why pars flaccida is flaccid, why pars tensa is tense. Okay? Are we understanding this much? Right? Okay? So I hope you guys are understanding. Keep putting your thumbs up so that I can understand that you guys are getting it. Right? Okay? Chalo. Now we have got this, right? Now we have got this particular annulus, we have got the pars tensa, we have got the pars flaccida. That is the problem. ये 0.1 millimeter में भी इतनी सारी चीजें हैं, right? Okay, so Tapa, you want to know the annulus, okay? Annulus कुछ नहीं है, ये fibers है ना, these fibrous layers are going on the lateral side, ये condense हो रहे हैं, और समझ के रखो ये condense होके एक rim बना रहे हैं. And this rim that you are seeing is the annulus. Okay, that is only around our pars tensa, not around the pars flaccida. तो हमने दो चीजें सीखी, that pars flaccida को flaccid क्यों बोलते हैं? Because एक उनमें configuration of fibers poorly formed है. Second, उनके around annulus नहीं होता. Annulus is only present around the pars tensa. Okay? तो अब simple सा ये सोचो, let us go back to what I taught you. ये tympanic sulcus था, जिसके अंदर हमारी tympanic membrane थी, right? And कौन सा part of tympanic membrane is present inside our tympanic sulcus? Pars tensa, right? And above the tympanic sulcus, it is deficient superiorly. और ये क्या था? What is this called as? This is called as notch of Rivenus, जिसके अंदर हमारी pars flaccida है. Correct? Right? अब I told you यही pars tensa की thickening laterally around the pars tensa एक और rim होती है. There is a rim, and that rim is called as what? That rim around the pars tensa, let us make it a little more prominent. ये rim that is present around the pars tensa, इसे हम क्या बोलेंगे? What will we call this rim? We will call this rim as the annulus. This is our annulus. And sometimes you also call it as annulus tympanicus. Why? Because it is present over the tympanic membrane. So simple तरीका ये हुआ that we have got a pars tensa जिसका lateral end पे there is a thickening which is called as annulus, and annulus is sitting inside a house which is called as tympanic sulcus. Till now we were creating this logic. And superiorly there is notch of Rivenus, and there is no tympanic annulus. There is fibrous layer which is deficient. That is why flaccida is flaccid. So तीन reason why pars flaccida is flaccid. One, it is present with a notch of Rivenus, that means tympanic sulcus नहीं होता. Second, it is not having a fibrous layer. Third, it is not having an annulus. That is what is pars flaccida. And tensa में ये सब है. That is why tensa is tense. That is why I told you, you wait for the time, I'll reveal everything to you. Okay, तो tensa में सब कुछ है. Tensa के around there is an annulus. Tensa के around there is a very well formed tympanic sulcus, and also there is a very well formed fibrous layer of the tympanic membrane. ठीक है? So that is the difference between pars flaccida flaccid क्यों है और tensa tense क्यों है. Okay? That is what the tennis racket formula is that I told you. Okay? अब मैंने बोला था, let's come back to drawing the tympanic membrane. Okay? So I've told you, I've revealed all these structures to you, right? Now I told you, whenever you're drawing a right side tympanic membrane, you have to shift it towards the right. जब आप left draw कर रहे हो, shift it towards the left. अब एक चीज याद रखना, जिस तरफ आपने टिल्ट किया है, whatever side you have tilted, that side will become anterior. that side will become anterior, opposite side will become posterior. यानी right side का anterior ये है, posterior ये है. This is the most important point, which is a very very simple way in which you can identify कि ये right है कि left है. If I'm drawing the left side, so if this is the side where my tympanic membrane is tilted, ये side मेरा anterior हो गया. Simple. And this side becomes posterior. Simple logic. This is how I remember. जिस तरफ you tilt it, that becomes anterior. Right की तरफ tilt किया है, right side का anterior ये है. Left की तरफ tilt किया है, left side का anterior ये है. Okay? Right? चलो. Now we have understood this much. Okay? Now we have understood about basics of कि हमने क्या क्या structures बनाने हैं. Right? अब, now, very very important point. Now, you need to divide the tympanic membrane into 4 quadrants. Okay, because this is a very important point when you do our pathologies. Okay, हमें पता होना चाहिए कि tympanic membrane में कौन सी जगह पे क्या problem हुई है. So now we have to divide the tympanic membrane, or this tympanic membrane has to be divided into 4 quadrants. We have to divide it into 4 quadrants. आपका favorite question in Viva. 4 quadrants में tympanic membrane को divide कैसे करते हैं? अब किस तरीके से, how will we divide it? Right? We have to take 2 imaginary lines. 2 imaginary lines, just imagine in your head 2 imaginary lines. One vertical line, one horizontal line. Okay? Now, if we draw one vertical line which is passing along the handle of the malleus. Right? One vertical line which is passing along the handle of the malleus. This is our first line. This is our first line. Okay? Let me just make it a little more visible to you so that you can understand. This is the line. Now you can see. This is the line, one along the handle of the malleus. Okay? Right? And we make another horizontal line perpendicular to the first line passing the umbo. Are we clear on this? Right? So again I'm going to tell you on this tympanic membrane, right? I am going to draw one line along the handle of the malleus vertically down. Okay? And another line which is horizontal and perpendicular to the first line crossing my umbo. Okay? Is everybody visualizing this? कि हमने कैसे इसको bisect किया? One line passing down vertically along the handle of the malleus. One line going perpendicular horizontally passing the umbo. Same idhar and same idhar. We have done one kind of cross, right? अब हमें 4 quadrant दिख गए बनते हुए. Now we have seen 4 quadrant. 1, 2, 3, 4. Right? So these 2 lines will divide my pars tensa into 4 quadrant. 4 quadrant में divide कर देगी. अब बहुत simple है. 4 quadrant को कैसे याद करेंगे? Anterior की तरफ anterior quadrant, posterior की तरफ posterior quadrant. That means I told you if this is my tilt, right side की ऐसे tilted है, जिस तरफ tilt है उस तरफ anterior, उसके opposite posterior. Left side में I have tilted this way, जिस तरफ tilt है, this side is anterior, पीछे posterior. Right? So now these are my anterior quadrants. And this is superior, so this becomes my antero-superior quadrant. This becomes my antero-inferior quadrant. This becomes my posterior-superior quadrant. This becomes my posterior-inferior quadrant. Simple. 4 quadrant of tympanic membrane. 4 quadrants of tympanic membrane. So let me just revise out what I told you. You need to be very careful in the questions the particular examiner will ask you. First, if they ask you what are the parts of tympanic membrane, you have to tell pars tensa, pars flaccida. If they ask you what are the layers of tympanic membrane, you have to tell epithelial, outer, middle, fibrous, inner, mucosal. If they ask you quadrants of tympanic membrane, then you have to tell antero-superior, antero-inferior, posterior-superior, posterior-inferior. Please be very careful in what the examiner is asking you. Okay? Same way, idhar bhi 4 quadrant ho gaye. This side is anterior, so I will say this is my antero-superior quadrant. This is my antero-inferior quadrant. This is my posterior-superior quadrant. This is my posterior-inferior quadrant. Okay, I hope you guys are understanding. I hope you guys have understood what are the 4 quadrants, what are the 3 layers, and what are the 2 parts of my tympanic membrane. What is pars flaccida? What is pars tensa? What is annulus? What is tympanic sulcus? What is notch of Ravenous? What are these quadrants? What are these 2 lines? Is there any question till now? Anyone who has got any question in not understanding this? Okay, fine. So now, with this, I'll move ahead. अब इतना हमने बना लिया है. Now, this is something which we are seeing normally. Okay? Fine? Right. Now. Okay. Ambo, Sudap, I think my chat is a little slow. So, okay. Sutapa, Ambo is the point where my handle of malleus is attaching. ये point, center. जहाँ पे मेरी handle of malleus attach होती है, this little point where my handle of malleus is attaching, इसे हम Ambo कहते हैं. This is called as the Ambo. Okay, fine. Chalo, now let's go on to understanding what are the structures seen in what quadrant. मतलब कि whenever we are doing an examination of the tympanic membrane, whenever we see a tympanic membrane, then what all structures we can see over the tympanic membrane. Okay, so let's first identify what we have already read, right? Correct. I think MBBS spectacles have answered right. Point of maximum concavity. That's actually what I told you. Great. Okay. अब हम देखते हैं कि क्या क्या चीजें हमें नॉर्मली दिख रही हैं टिम्पैनिक मेम्ब्रेन पे. वी कैन सी अ पार्स टेंसा, राइट, एंड दिस पार्स टेंसा इज ग्रे इन कलर. दिस इज ग्रे एंड ट्रांसलूसेंट. ये शाइन करता है, ग्रे ट्रांसलूसेंट शाइन होता है इसमें. इट्स ग्रे एंड ट्रांसलूसेंट. देन वी हैव गॉट द पार्स फ्लैसिडा विच इज पिंकिश इन कलर, विच इज पिंक इन कलर, विच इज पिंकिश इन कलर. इट इज कॉल्ड अ पिंक इन कलर, राइट. अच्छा, वन थिंग मोर, पार्स फ्लैसिडा हैज ऑल्सो गॉट अनदर नेम. इसका एक और नाम होता है, यू शुड नो दैट. इट्स कॉल्ड एज Shrapnel's membrane. It's called as Shrapnel's membrane. इसे हम लोग Shrapnel's membrane भी कहते हैं. Shrapnel's membrane. Okay. So pars flaccida is usually pink in color. Pars tensa is usually gray and translucent. Then what we made, इसके around ये annulus होता है. That is around the pars tensa. You have got two malleal folds, anterior and posterior malleal fold. ये posterior है, ये anterior है. Then we have got this handle of malleus, what we can see. We can see the umbo, we can see the pars flaccida, we can see the notch of Rivenus, we can see this tympanic sulcus. These are the normal parts which we can see till now. Till now, these are the normal parts which we can see. Okay? Now, there are certain reflections, or there are certain structures which can be seen as reflections through the tympanic membrane. And I told you, when you were reading the middle ear, right? Ab khud socho, if this is the lateral wall of the middle ear, then there are some structures present medially which you will be able to see. क्योंकि ये gray है, ये translucent है, it's transparent, right? Right? So you will be able to see certain normal structures present in the middle ear through this membrane. Normally. And we should be knowing what all structures are present there. Okay? Now what structures can be seen? Now I want to ask you a very simple question, and if you remember my last lecture, this is a bonus question for you all. What opens in my anterior wall of the middle ear? What is opening in my anterior wall of the middle ear? I told you very important structures open in my anterior wall of the middle ear. Right? And that is one thing which you will see as a reflection through my tympanic membrane in the anterior quadrant. That one structure. Okay? So there is one structure that is called as the eustachian tube. And that eustachian tube is seen as a reflection, क्योंकि eustachian tube के अंदर air होती है. And that eustachian tube is going to be seen as a black reflection through my anterior quadrant of the tympanic membrane. मतलब यहाँ पे I'll see something black, like a black shadow. Why? Because it is in the anterior wall of the middle ear. And I'll see that as a blackish shadow, क्योंकि उसके अंदर air होती है. Right? Very good, Anant Krishnan. That's the eustachian tube. Right? So this is a shadow of the eustachian tube which you will be able to see in the anterior quadrant of the tympanic membrane. Anterior side. क्योंकि वो anterior wall में खुलता है. So in the anterior side or the anterior part of my pars tensa, I will be able to see. Right? Very well. ET and TT. Right? So Maya, it's absolutely right. So I can understand. I hope now you guys are getting anatomy and getting ENT. Okay. So eustachian tube दिखता है. Normally eustachian tube दिखेगा. It will be seen as a black color की shadow. Okay? चलो, अब एक और चीज इंपॉर्टेंट है. When we shine our light, क्योंकि हम लोग को लाइट डालनी है ना, we have to see that tympanic membrane through our light, right? So when we put our light, and the instrument by which we see the tympanic membrane is called as an otoscope. Okay, otoscope. So when we put the light of an otoscope, right? So we know one fundamental of physics, right? That जिस तरफ bend होगा, उस तरफ light will reflect and it will shine. When we send that light through the otoscope, the area towards which my tympanic membrane is bent, that area, it will reflect light and it will form a cone. It will form a cone, a shining cone. And this shining cone which is seen in which quadrant? Antero-inferior quadrant. This is called as cone of light. Cone of light. Now, cone of light क्यों बनता है? Cone of light is formed. Why? Because of the reflection of your otoscope light. जब हम light मारते हैं, so it will reflect, and the side towards which my tympanic membrane is bent, that side we will get a reflection of that light. And that reflection of light forms like a cone, and we will call it as cone of light. We will call it as cone of light. Now, this cone of light is very important to tell whether my tympanic membrane is healthy or not. अगर ये cone of light absent हो जाएगा, that means my tympanic membrane is dull. Dull मतलब it is not healthy. If this cone of light becomes distorted, मतलब ये टूट गया. Now let's say it has started to break. ये नहीं अच्छे से बना हुआ है. Then what will we say? That there is some kind of a disease in the middle ear, which we need to see. क्योंकि ये cone of light नहीं है. It is distorted. So cone of light will tell me that what is my health of the tympanic membrane. And a good formed cone of light means my tympanic membrane as well as my middle ear is healthy. Are we understanding? Right? So ye tympanic membrane is like a reflection of my middle ear. It will tell me about the health of the middle ear compartment. Are we understanding? So cone of light is formed in the antero-inferior quadrant. In the antero-superior quadrant, we will see a kind of a shadow, and this shadow is of the eustachian tube, which is a black colored shadow. Okay? Fine? Chalo, now. अब मुझे खुद सोच के बताओ, खुद सोचो, just put up your brain and think. Okay, I want you guys to think. If this is my lateral wall of the middle ear, that means ये मेरी lateral wall है tympanic membrane. I've spoken much about you in the medial wall of middle ear. यानी कि अगर मैं lateral wall हटा दूं, if I just remove, let me just draw it over here. If I remove my lateral wall, मैंने हटा दी. Let's say I've removed it. So which wall of the middle ear you will see inside? When I remove this lateral wall of the middle ear, कौन सी आपको wall अंदर दिखेगी? Which wall will you see? Right? Which wall are you going to see? Over on this area? कौन सी wall दिखेगी? Eustachian tube is in the anterior wall. I'm talking about wall. Medial wall, lateral wall, anterior wall, posterior wall. कौन सी wall दिखेगी when you remove this medial wall? Correct. Medial wall of the middle ear. Medial, क्योंकि lateral हट गई तो we will see medial. And if you guys remember medial wall of the middle ear पे क्या था? What was there on the medial wall of middle ear? I had a very important structure in the center, जो कि एक bulge था, and that was promontory. That was promontory. Correct? And I told you, posterior superior to the promontory is my oval window, and posterior inferior to the promontory is my round window. तो एक तरफ मेरी round window है और ये मेरी हो गई oval window. Correct? So these are the two windows which are present, posterior superior and posterior inferior to my promontory, which is the medial wall of the middle ear. Okay? Right? If you remember the medial wall, what I taught you. Okay. Now, what opens over the oval window? Oval window के ऊपर क्या है? What opens over the oval window? Over the oval window, there is a very important structure that opens, and that is my stapes. That is my stapes. Stapes open करती है oval window के ऊपर. I told you that when I was telling you about the middle ear, right? So stapes is opening over the oval window. Correct? Right? And this stapes ऊपर connected किससे? It is connected to my incus. So incus and stapes are making a joint here, and this is called as incudostapedial joint. Incudostapedial joint. यानी incus ऊपर मेरे stapes से जुड़ रही है, and that stapes is opening in the oval window, and that is forming a joint which is called as incudostapedial joint. Okay? So if I ask you, incudostapedial joint की shadow किस quadrant में दिखेगी? Which quadrant will have incudostapedial joint shadow? What answer will you give me? In all of these four quadrants, where will you see incudostapedial joint shadow? What will be the shadow? Okay? Where will this be? Where will you see this shadow? It will be over on this posterior superior quadrant. Absolutely right. Because see, ये posterior superior है. Right? So, you will see this incudostapedial joint shadow over here. It's medial. Always remember, I'm seeing a shadow. मतलब ये medial है. So, I'm seeing a shadow of this incudostapedial joint in my posterior superior quadrant. That is the reason if I ask you what is the most important quadrant of the pars tensa, you will say it is the posterior-superior quadrant. If I ask you what is the most dangerous quadrant of the pars tensa, you will tell me posterior-superior quadrant. I will ask you why, and you will tell me because there is incudostapedial joint in the posterior-superior quadrant. That means, let's say, if we get any disease in this part of the pars tensa, always there is a chance that my incudostapedial joint will get harmed and my hearing loss will increase. This is why posterior-superior quadrant is the unsafe quadrant of the pars tensa. Always remember that. Out of all of them, the most unsafe is the posterior-superior quadrant. Okay, fine. I hope you guys have understood right now. So we have done the eustachian tube shadow. Cone of light is present in the antero-inferior quadrant. Then I told you there is a shadow of the incudostapedial joint which is present in the posterior-superior quadrant, right? And you know this is a round window, right? And round window actually is open, right? It's open. So you can see a shadow of the black or a black colored round window in the posterior-inferior quadrant. So you'll see a shadow of round window which is present in the posterior-inferior quadrant. Okay, fine. So these are the reflections what you will see in your pars tensa. Whatever I made, this is going to be your whole tympanic membrane that you will draw and you will explain. Now I hope you have understood how to draw a normal tympanic membrane and what are the things that you will see in a normal tympanic membrane. I hope you have mastered that concept. Okay? Same way, now I'll put up the structures here. Same thing I'll put up here, right? This is posterior superior, posterior inferior, antero superior, right? यहाँ पे भी same चीज बना लेते हैं. What all we will see? We will see the cone of light which is coming in the antero-inferior quadrant. Correct? We will see a eustachian tube shadow which is present in the antero-superior quadrant. Right? We will see a round window reflection that is present in the posterior-inferior quadrant. And we will see a reflection of the incudostapedial joint in the posterior-superior quadrant. Okay? Got it? Right. Now, so we know things right now. We know things. What is anterior? What is posterior? What is a normal tympanic membrane? What is a cone of light? What is the importance this cone of light holds? Why posterior superior quadrant is the most important among them and why this incudostapedial joint always poses a risk of getting injured. Right? And if any disease is present in the posterior superior quadrant, we call that as, or will label that as unsafe here. Okay? We call that as unsafe here. Right? Okay. So this is what is the whole logic behind how we draw a normal tympanic membrane, right? And I hope you have drawn in your copies right side and left side. Remember, take your hand, tilt it towards the right, take your left hand, tilt it towards the left. The side you're tilting is the anterior. The side you're tilting on the left, that becomes the anterior, right? Okay, great. Now, okay, so we have got a logic behind what exactly is this normal tympanic membrane, and we have done about what are the layers of the tympanic membrane. Like, now let me show you how exactly a tympanic membrane looks like. Okay, this is what your normal tympanic membrane looks like. Okay, when you see from your eyes, when you put your otoscope inside the ear, what will you see inside? You'll see this. Now see and label and think about what all we read. Same things, apply it here, right? Now see here. We have got two parts of the tympanic membrane, right? We have got this part over here, right? This is what? This is our pars tensa. This is the pars tensa, right? The tense portion. Then we are seeing something pinkish above, right? This is gray and glistening. This is what? This is slightly pinkish. This is our pars flaccida, right? This is the pars flaccida which is present above, right? Now we know that this pars tensa is present around in a rim. And what is this rim? What is this sulcus? This is our tympanic sulcus. Correct? This is our tympanic sulcus. And the tympanic sulcus is deficient superiorly. So we don't have a tympanic sulcus superiorly. So what is this area? This is our notch of Rivenus. This is our notch of Rivenus. Correct? Around the pars tensa, what did I tell you? Around the pars tensa, there is a thickening of my fibrous layer. And what do we call that? We call that as the annulus. So this is my annulus, which is present around the pars tensa. Annulus is not present around the pars flaccida. That's what we have read. Correct? Now, when we see the structures over on the tympanic membrane, what you can see the handle of the malleus in the center, right? This is the handle of the malleus, what you can see in the center, right? The point where my handle of malleus is attaching, we call it the umbo. Correct? We call it the umbo. Now you guess and tell me, what is this side of the tympanic membrane? Is this the right side tympanic membrane or is this the left side tympanic membrane? Simply think. Put your hand, see here and tilt it towards the right. If this is my right side, this is going to be my anterior side. This is my anterior side. This is my posterior side. And the second thing, how I can actually make out that this is right side tympanic membrane is what? Is by this cone of light. So simply see the cone of light. If it is going towards the antero-inferior quadrant on the right side, it has to be the right tympanic membrane. Simple, right? You guys get it, right? Now you guys have got it. What is right and what is left? Great. Now, this is what? This is the antero-inferior quadrant. How did I know that? I drew two imaginary lines, one along the handle of malleus, one along passing the umbo. Antero-inferior has got the cone of light. You can see a shadow of the eustachian tube, something black over here. This is in the antero-superior quadrant. This is for the eustachian tube. Similarly, you can see a faint shadow over here. You'll be seeing a very, very small shadow, okay? It's a very small shadow. And this shadow over here is of what? This is of what in the posterior-superior quadrant? What do you see here? It's a very important joint. And what is that? It's the incudostapedial joint. That is why this quadrant becomes posterior-superior quadrant. And this is our posterior-inferior. Right? This is the most important concept behind what is your tympanic membrane. I hope you guys have mastered, and now in your exams, as well as also when you go for your vivas, your examiner will definitely ask you that, beta, try to show me how a normal tympanic membrane looks like. So you have to draw this diagram and show it to you. Especially whenever we will do diseases like chronic otitis media, we will need to make perforations over them. So perforations sabhi samajh mein aayenge if we understand about what is this normal tympanic membrane. Okay, so we are building up a concept over here. And this is going to keep coming when you read your further topics. Right? Okay, fine. Now we have understood. Now we have understood and we know what is a normal tympanic membrane. Chalo. Now, with this, we'll move on to what is the supply of the tympanic membrane. Right? So supply means the last part of the tympanic membrane. We'll do the blood supply of tympanic membrane. And we will do the nerve supply of tympanic membrane. We'll do the blood supply. And we will do the nerve supply of tympanic membrane. Okay, fine. Now, what is the blood supply of the tympanic membrane? Blood supply of the tympanic membrane is important laterally and it is also important medially. Okay, there is a separate artery on the lateral side of the tympanic membrane. There is a separate artery on a medial side of the tympanic membrane. Okay, so let's just see the tympanic membrane from the side. Let's see it from the side. Okay, so let's say this is your tympanic membrane when you are seeing it from the side. Okay, this is your tympanic membrane when you are seeing it from the side. So this is our lateral surface. This is our medial surface. Okay. Now, one important artery supplies the lateral surface of the tympanic membrane. Two important arteries are supplying the medial surface of the tympanic membrane. Okay, fine. What is one important artery which is supplying the lateral surface of the tympanic membrane? One artery which supplies the lateral surface of the tympanic membrane is called as deep auricular branch. Deep auricular branch of maxillary artery. Deep auricular branch of maxillary artery. So there is a maxillary artery, right? Maxillary artery is a artery which is coming from the external carotid artery. External carotid artery is giving a branch which is called as maxillary artery. And this deep auricular branch of the maxillary artery is going to supply the lateral part of my tympanic membrane. Okay, remember that. Here, there are two arteries, right? And they are the same arteries I taught you when I was teaching you the middle ear. Because you see, the medial surface of the tympanic membrane is actually the mucosal layer. It is a part of a middle ear compartment. So the same supply of middle ear is going to come here. And what were the two arteries I told you in your middle ear when I was teaching you the blood supply of middle ear? I told you there is something called as anterior tympanic artery. Anterior tympanic artery, which is a branch of maxillary artery. Which is a branch of maxillary artery. Okay, and then I told you there is another branch which is called as stylomastoid artery. Stylomastoid artery, which is a branch of posterior auricular artery. Okay, same things what we read in middle ear. So stylomastoid branch of posterior auricular artery as well as anterior tympanic artery, which is a branch of our maxillary artery. This is going to be the supply on the medial surface of my tympanic membrane. And on the lateral side, I've got the deep auricular branch of the maxillary artery, which is supplying my lateral end. Okay, so this is going to be the same. If you remember this, you're also going to remember the arterial supply of my middle ear. Same arteries are supplying my middle ear compartment. Okay, fine. So this is about how we read the blood supply of the tympanic membrane. ठीक है, समझ में आ गया? Now we have understood about what is the blood supply, right? Okay, now let's go into more important aspect. अब पढ़ते हैं what is the nerve supply. Nerve supply of the tympanic membrane भी lateral side पे different है, medial side पे different है, right? So now let me draw a normal tympanic membrane. Let me draw a right-sided tympanic membrane, right? This is my right side tympanic membrane. This is my right side tympanic membrane. If this is my right side, then the side it is tilted to, this is my anterior, and the ulta, this is posterior. This is my anterior, this is my posterior. Correct? That is what I told you, right? And I told you that if I draw an imaginary line along the handle of the malleus, and if I draw another imaginary line passing the umbo, this side will divide it into 4 important quadrants. These particular lines will divide my tympanic membrane into 4 important quadrants, right? That is what we have read. Up this is the lateral side, andar wali is the medial side, right? Which is towards my middle ear compartment. Now, what is the supply of my lateral half of the tympanic membrane or the lateral side of the tympanic membrane? A for anterior, A for auriculotemporal. That means A for anterior, anteriorly the nerve which is going to supply my tympanic membrane is auriculotemporal nerve. Okay, which is going to supply my anterior half of the tympanic membrane. Okay, and this auriculotemporal nerve is basically a branch of, it's a branch of V3 division of trigeminal nerve. What is V3 division? V3 matlab mandibular division of the trigeminal nerve, right? Trigeminal nerve has got 3 important divisions, right? V1, V2, V3. V1 ho gaya ophthalmic, V2 ho gaya maxillary, V3 ho gaya mandibular. Mandibular division of trigeminal nerve, V3 gives off this important branch which is called as auriculotemporal nerve, which supplies my anterior half of the tympanic membrane. Okay, fine. Now, what is about the posterior part? Posterior is supplied by vagus. Posterior is supplied by vagus. And I told you, when I was telling you about the external ear, what is the branch of the vagus going inside the ear called as? Very, very important question, hit question. What is that branch of the vagus going inside or supplying the external auditory canal as well as the tympanic membrane called as? It is called as Arnold's nerve. It is called as Arnold's nerve. Okay, this is your Arnold's nerve. Right? Fine. So now we have understood about what is the lateral surface of the tympanic membrane supplied by. Okay, this is what exactly is the lateral part or the lateral surface of the tympanic membrane which is being supplied by. Okay, now let's go into the medial surface. Ab medially kya hai? Medially hamara middle ear hai, right? And medially middle ear mein there is a very important, I told you, nerve that is entering into the middle ear. And that is coming from the floor of the middle ear. Kaun si nerve thi wo? That was what? That was the glossopharyngeal nerve. Right? That was a glossopharyngeal nerve. So glossopharyngeal nerve is coming from the floor of the middle ear. Remember, recap your middle ear. And this nerve which is entering inside from the floor of the middle ear, the branch of the glossopharyngeal which is supplying the middle ear, this is called as Jacobson's nerve. Jacobson's nerve. Okay, fine. So this is about the nerve supply of the tympanic membrane, right? So you have got what? You have got the lateral supply, you have got the medial supply. Lateral supply is coming from the anterior segment, that is what? From the auriculotemporal nerve. Posterior segment is coming from the vagus nerve through the Arnold's branch. Arnold's nerve is a branch of the vagus nerve supplying the posterior quadrant. Then I come to the medial side. Medial side of my tympanic membrane is supplied by, it is supplied by my Jacobson's nerve. And Jacobson's nerve is a branch of glossopharyngeal nerve or my 9th nerve. All of these points are your questions. They have 10,000 times asked what is Jacobson's nerve. They have 10,000 times asked what is Arnold's nerve. Absolutely right. Right? So you guys are answering right. Okay? Absolutely right. That is Arnold, Soumyadeep. And so this is what exactly is your whole story behind what is the tympanic membrane. Okay? Fine. right? So I hope you guys have understood about each and everything, what I had to tell you about what is the tympanic membrane. Small, yet a very important structure, which forms one of the most important concepts in understanding diseases later on. जैसे जैसे हम लोग बढ़ेंगे ना, वैसे वैसे हमें diseases इसी से समझ में आएगी. Like we will understand about the diseases like that. Okay, fine, chalo. Now, so this basically finishes our chapter on tympanic membrane. Right from the beginning, we understood about what is the structure of the tympanic membrane, what is the house of the tympanic membrane. We understood about the tympanic sulcus. We understood about the notch of the ravenous. We understood about those spines. Then we had put the tympanic membrane inside. We understood about what is the pars tensa, what is the pars flaccida. Then finally, we understood about the logic behind why tensa is called tensa and why pars flaccida is called flaccida. Correct? We understood about how to draw a normal tympanic membrane on the right side as well as on the left side. Further, we went on to understand the three layers of tympanic membrane: outer epithelial, middle fibrous, and inner mucosal. Right? और यही मैंने बताया था आपको कि these are the three layers. The inner mucosal layer is continuous with the middle ear. Middle fibrous layer is the one which contains three configuration of fibers: parabolic, circumferential, and radial. And outer epithelial one, which is containing stratified squamous epithelium, it is continuous with our external ear. Then we came to the blood supply of the tympanic membrane. And finally, we read about the nerve supply of the tympanic membrane. Anterior ki auriculotemporal nerve, posterior ki vagus, and the medial part is supplied by the Jacobsons. This is all, and I hope you have understood as well as mastered one of the very important topics of ENT, and as far as this is one of the favorite topics of your examiners, and that is about tympanic membrane. Okay? So I hope you guys have understood about the lecture. I'll wait for your questions, whatever questions you have to ask. If you want to recap again something, if you want to learn something again, if you have not understood something, please mention that in the chat box. I'll be happy to, clarify your doubts right away. Okay? Right, my chat box is working a little slow today. So I'm seeing a lot of right answers coming up. And all of you, whoever is writing, all of you are on the right track. That means all of you are answering everything right. And I'm very happy when you guys answer right. Nothing makes a teacher happier when their students answer, right? That's the happiest part we all are working for every day. So that is the point. We understand that you are understanding. Okay, MBBS spectacles, I'll teach you the whole ENT. Yes, I'll teach you the whole ENT. Don't worry. I will come up with a lot of lectures, okay? We are running a series of lectures over on ENT. We will come up with many, many lectures ahead. This is just the beginning. Okay, it will keep on becoming complex and complex and complex, and you guys will understand with time. Right? So I hope you guys have understood. Okay, so Tapa, Arnold's nerve is a branch of vagus nerve. Or vagus nerve supply karti hai posterior part of the tympanic membrane. Arnold's nerve is a branch of vagus nerve. Okay, thank you guys. Thank you for all your appreciation. Thank you for attending today's session, and I hope you guys are revising. Your DPPs have been given to you. Please keep doing the DPPs. Please keep doing the questions. Please keep answering those questions. If you don't, because those are NEET PG questions, INI CET questions, FMG questions, what have been asked. So those DPPs are very important. Okay, so please go and do those DPPs regularly. Keep posting your answers, and if you don't understand anything, ping us, and we will directly answer your doubt straight away. Right? So this will be a goodbye from my side. Okay. Yeah. There is a lot of real life videos and lectures pictures that are coming up. Right? Don't worry. I'm not showing you the real life videos right now. Why? Because I've saved it for the surgical point of view. You'll get it soon. Don't worry. Right? Yes, Rajbir, I'll keep motivating you. I'll be after you so that, you score the best in your class. Okay, so good night, you guys. Have a great day, and I hope you guys will watch the IPL match right now. Okay, so enjoy your life, enjoy your studies as well, and keep shining, keep rising. Okay, good night.